The actress Glenn Close once said, "What mental health needs is more sunlight, more candor, more unashamed conversation." According to a recent World Health Organization study, around 450 million people worldwide suffered from mental illness. We are here today to bring light on an often forgotten topic of mental illness in Myanmar. We're going to give some background about this mental health problem in Myanmar, discuss the stigma around this health issue, and help spread awareness about the importance of understanding this invisible disability.
Whoa. First off, we gotta start from the basics.
What is wrong with this person? Is she homeless, fake, too happy, tired, or trying to look okay? Well, she's suffering from mental illness. 1 in 4 people will suffer from mental illness, and it is not something anyone can see. Mental health and depression is an invisible disability. It is often misunderstood, stigmatized, and ignored.
Do you know what mental health is?
So from my point of view, mental health is a very important health condition for the woman's well-being, which include the emotional, psychological, and then the social well-being, because it has a very big impact on the way people behave, the way people feel, and the way people think.
Okay, I think it is a condition of a person's mood. So it's either happy, neutral, sad, or depressed, for example.
Yes, I do. I've got a good understanding of mental health. A number of people in my family have had mental health. One of them's quite close to me, so I do know what mental health is.
Do you know anyone who has mental illness? If so, what have you done to help them?
So I have a very close friend who has been triggering from the mental health condition called anxiety. So whenever he has an anxiety attack, I just try to find out the source that triggers him and make sure that he knows that he will be fine, and I just try to comfort him.
Yes, I actually do, and a lot of my friends, they have been facing this problem. They tend to be sad and depressed, even though sometimes they may seem like they're happy, laughing, smiling. What I do to help them is I take them out for activities, I try to entertain them, but I am not sure if that is gonna solve the problem, but at least that is what I can do.
Yes, my mother. So it's quite difficult because she's quite far away. She lives in England, but when I go home, I always take care of her, take her out to many places, and listen to her. Whatever she needs to talk about.
Do you think mental health is a disease or just pure laziness?
Mental health is definitely not a pure laziness at all, because this is not what people choose to suffer from. So it's not like a disease that occurs because of the dysfunctions of the internal organs, but it's more like the way that the brain react to the external factors and situations.
I think it is a kind of sickness. It's not laziness. It's probably how people process things. They are sick, they are unhappy. This is probably true.
It doesn't relate to laziness directly, but it can make people appear to be lazy. But it's definitely a disease. Some people just have trouble coping with life. But it's not a disease that's obvious that you can see.
What do you think a person experiencing mental illness looks like?
So there's no logical appearance that a person with the mental health should look like. Usually people with the mental health looks really stressed, and they're usually low in self-esteem, and they're not really confident, and they are not really enthusiastic to participate in activities, and they just would like to withdraw themselves from the society and the community.
You cannot actually tell, from the look. If they are sad and depressed, they don't want to make friends, they don't want to go out. That could be one of the reasons, but it doesn't mean that people who are happy all the time doesn't have the mental health problem.
probably just like you and me. Unless it's a very severe case, in many ways it's very difficult to see that somebody's ill. It's not like having a broken leg, but it can be just as debilitating in many cases.
We created a questionnaire to assess the whole school on their thoughts on mental health, and we have some interesting answers. Here are some of the responses.
Let's put this straight. Stigma can be harmful. In spite of this, we still subconsciously stigmatize things and individuals because we're afraid of things we don't understand. When we are not educated on issues such as mental illness, we tend to create negative images about it, which consequently make it easier to make fun of people with diseases, not knowing how hurtful it can be.
Here are some facts about mental illness in Myanmar. First of all, what is the main contributor to mental illness in Myanmar?
Mental distress affects the well-being of the Myanmar people, like all other countries. According to a recent Global Burden of Disease study, depression and anxiety are the main mental health disorders in Myanmar. A main contributor to depression and anxiety are financial problems, and it is said that Myanmar women are more likely to suffer from depression due to having high burdens on their high expectations within the family.
In what areas are we doing well and what areas can we improve on?
Mental health issues have not been fully understood in Myanmar. Things are beginning to change and more awareness is starting to spread. According to the Mental Health Hospital in Myanmar, between 2013 and 2017, the number of patients treated increased by 58%. The government has set up specialized clinics in Yangon. Mental health care was drafted in 2017 to provide basic essential mental care services to communities. By 2021, movement with Aung San Suu Kyi to tackle mental health problems.
0.3% mental health care budget is too low. Services are undeveloped and lacking infrastructure. There are not enough trained staff, especially in rural areas.
What organizations are helping with mental health and what are they doing to help?
UNFPA is a lead agency for mental health in Myanmar, working to provide mental health services. They provided support for survivors of gender-based violence in conflict-affected areas in Myanmar, and including mental health services. UNFPA has been providing counseling and group support activities as well as education training.
Finally, these are the common causes of mental health stigma in Myanmar.
Myanmar people still traditionally believe that evil spirits and witches cause mental health problems, suggested by healthcare professionals that normalization of negative emotions is also another factor. Despite this, we are seeing improvements that are taking place. In conclusion, the brain, although it is the most vital organ in the human body, it can also break. 25% of us will suffer mental health issues in our lifetime, and we should not be ashamed of that. Although it is not visible like a broken leg, it can often be disabilitating. There's been a lot of research on mental health in Myanmar, and there is a lot to be positive about moving forward.